So like Jen had said, so I'm a PM&R physician. I specialize in sports medicine. So I treat quite a bit of pain, injury type of medicine. So today we're going to be discussing pain management for rheumatic conditions. Oh, okay. So so what's included in the rheumatic conditions that we're going to be discussing? So there's a lot of different conditions that can cause pain. Some of them are osteoarthritis, which is the most common type of arthritis, rheumatoid arthritis, PMR, which is polymyalgia rheumatica, fibromyalgia, gout, CPPD, lupus, spondyloarthropathies, and then post-viral arthritis. So first, we're going to focus a little bit on the stress management techniques. So I would like to introduce one of them in detail to you. That's called MBSR. So this is this is basically mindfulness meditation. It's a program that has been put together by John Kabat-Zinn from University of Massachusetts Medical Center for people with chronic pain. So it is like an 8-week program, in-person practice, and basically it has been shown to have repeated demonstrations of effectiveness. It's been used across broad settings and populations, and it's been proven to be effective. And it's also been proven to be effective with people with autoimmune conditions. So mindfulness is the non-judgmental observation of the ongoing stream of internal and external stimuli as they arise. So what does that basically mean? So basically, changing beliefs via meditation can change your experience of pain. For example, people generally don't like bitter food. However, they're much more willing to consume a bitter pill because they want to get better. And so, meanwhile, when one thinks that meaning of eating a pill, the bitterness of the pill is decreased in their mind. So this kind of has a little bit to do with mindfulness. So mindfulness meditation works to train people to view pain as a bare sensation. So going into it a little bit more, when people are experiencing pain, they don't usually go, I have some pain. There's usually more thoughts that are associated, such as this pain is killing me, or this pain will last forever, or I will never get better. I have pain, so I can't do this or I can't do that. So it's kind of like you're running on autopilot. So the thought is now, we can't eliminate pain by our thinking, but we can change the interpretation of pain. And we can see it as a sensation. We can detach it from the other feelings of depression, of anxiety, of stress. And so we want to re-engage or reopen you to other sensations that you ignore because you're so overwhelmed by the severe pain. So you could say something like, I feel pain in my stomach, but my arms, legs, feet, and other parts of my body are fine. So it would change the way you feel about pain. So there are a few different types of mindfulness meditations. So the first one I'm going to talk about is breathing meditation. It's a practice where you focus your attention on the sensations of breathing. This is probably the most common one that most of you have heard of, which is the meditation. Body scan. So this basically is a practice where you focus on each individual body part in turn from head to toe to see how do you feel in those body parts. Some of them may be in pain, but others are feeling fine. Another one is love and kindness meditation. This practice is designed to actually foster positive feelings of love and care. So initially, towards a close loved one, and then you can extend it to yourself, and then you also extend it eventually to the whole world. So it's just a broader sense of a feeling of well-being. And then the last one is observing thought meditation or sitting and walking. So this teaches you to notice as thoughts arise to label them, for instance, as positive or negative, but avoiding absorbing them. So now moving away from meditation, this is a little bit more of what I focus on in my practice, physical exercise. Regular physical exercise, particularly aerobic exercise such as biking, walking and swimming, They've all been linked to reductions in stress and improvements in mood. People tend to stop exercise after they do develop autoimmune conditions, and this feeling pain, the feeling of the pain actually stops them from exercising. So it becomes a little bit of a vicious cycle. When you are not exercising, you can get more stiff, you can have more inflammation. So it generally increases your pain. So exercise has become more important for people with autoimmune conditions compared to healthy people. So lack of exercising can actually increase the risk of flares as well. There are also other negative consequences of not exercising, such as heart problems, muscle degradation, mood swings, and excessive stress as well. And these issues tend to impact people with autoimmune diseases more than healthy people as well, unfortunately. So by doing some intentional and selective exercise, particularly aerobic exercise, you should be able the course of your disease. And it also, of course, it releases endorphins, neurotransmitters, and promotes feelings of happiness and well-being. There is a fine line to how much exercise you should be doing. It has to be something that you feel comfortable with. Of course, if you overdo it, you can also have a flare. So it's somewhere in between. So this is something where if you're not sure what you're doing or how to go about, this is where physical therapy comes in. A therapist and a physician can work with you to get you on a proper exercise program. So the next one we're going to discuss is mind and body. So aside from mindfulness, meditation, and exercise, yoga and Tai Chi both help in controlling pain. They both generally incorporate stretching, breathing exercises, flowing movements. They help improve your spinal health and reduce stress on the affected joints. The benefits of yoga and Tai Chi is it improves your balance generally, your muscle strength, your core strength, and your overall mobility. It also improves your balance, which is a very big thing. And it also helps reduce stress and anxiety and depression. So aside from that, there's other self-management and stress reduction techniques. These are other techniques that help reduce pain. Some people focus on prayer. Music is another good outlet. Art, and then emotional support animals like trained dogs or having family or friends to talk to can help control or help you control your pain a little bit better.
Dr. Sutaria, so for some reason your connection is quite bad. Sometimes you go really fast and sometimes we hear it really slow. So one of the participants suggesting maybe you can try to turn off the video.
Oh.
The participants suggesting you can try to turn off the video.
Turn off the video? So let's do that.
Your video. Yeah. And then we're still gonna see the slides. Are you still with us?
Okay.
Recording in progress.
Okay. So I'll talk a little slower. I'm not sure if that will help. But the next thing I wanted to talk about was heat and cold therapy. Heat and cold is very commonly used to control pain. And I often get questions from patients, is heat or cold better for me? So generally, I think the right answer is whatever helps you feel better. But these are the more specifics of when to use heat and to use cold. So heat in general is for relieving muscle pain. It's for loosening stiff joints, and is to help relax areas of tension. There's two different types of heats, which is important to know. There's dry and then there's moist heat. So dry heat is the heating pad you plug into the wall, like the electric heat that you can use, or the heat that sometimes you can microwave. I know there are some of those packs you can microwave. Those are considered dry therapies. And then there's also moist therapies. These are the ones that generally do go deeper into your joints and your muscles. These are the ones used by physical therapists. These are the ones I use in my physical therapy gym. So hydrocollator packs where you can have a hydrocollator pack in boiling water and put that on your body that would produce heat for longer. It also goes deeper into your joints and your muscles. And then hot tubs and steam towels would be other moist therapies. And then there's cold therapies. So ice is used for reducing inflammation, numbing sore tissues, and minimizing tissue damage post-injury. And you can try localized therapies like ice packs or cold compresses, and then the regional therapies, which is where you use cold showers or cryotherapy chambers or ice baths for larger portions of your body if you're trying to control inflammation. So now I'm going to talk a little bit about alternative and complementary therapies. And so when it comes to alternative and complementary therapies, there's three different types. There's acupuncture that we're going to talk about. We're going to talk about massage therapy, and we're also going to be talking about herbal remedies. So acupuncture is commonly used to reduce tension in the muscles. It involves inserting thin needles into specific joints of the body to remove pain. You can reduce joint pain, improve mobility. In some people with rheumatic conditions, generally you can go about twice a week. You would have to go to a specialist for acupuncture. Massage therapy, where a gentle massage can be used to help relax the muscles, improve circulation, and reduce pain. And it can help reduce the stiffness in joints. Regular sessions with trained therapists can provide significant relief. Massage therapy is commonly used in physical therapy at the beginning of the treatment as well. And then there's herbal remedies. This is a common question I get as well. What should I or shouldn't I be eating? I'm not really going to go through that specifically, but a lot of people do turn to anti-inflammatories in order to control or do something to control their inflammation. And a really common active ingredient used is turmeric. It reduces, it has anti-inflammatory properties. It can help reduce inflammation in the gut. And it has antioxidant activities as well. It can modulate gut bacteria. And then aside from that, aloe vera and boswellia, as well as slippery elm, they all have potential to alleviate symptoms such as abdominal pain and diarrhea in people with IBD. So before you do go and start your herbal remedies, you should definitely discuss it with a healthcare provider to make sure it's a good idea with your treatment plan. And then there's support groups and counseling that can help, connecting with others who understand your experience can definitely help control your pain. You can understand where they're going through and understand that, what you're feeling isn't quite that different. It can help you cope with emotional and psychological aspects of the condition as well. And sleep is also a very big factor in pain. I feel like if you're not able to have a good night's sleep, you're going to stay in a chronic inflammatory state. So adequate sleep definitely helps reduce inflammation. It helps improve immune function and enhances overall well-being. So a few tips on how to maintain adequate sleep is maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and then minimizing sleep disruption, such as pain and discomfort. I often do tell my patients if you're in quite a lot of pain right before you go to sleep, then that might be a good time to take something to help control your pain. If you are on something, because having a good night's sleep is very important for inflammation. So that was kind of what I had planned for today. I don't know if everyone heard everything since I guess it broke up somewhere in the beginning. So if there's anything I need to repeat, please let me know.
And given it's a small group, I think if you have any questions for Dr. Sutaria, just please raise your hand and I'll call folks. And you can come on mute.
Should we try to do video so I can, if you can't, if it slows down again, let me know.
It's okay now, actually.
Sorry, I'm not seeing how to raise a hand.
Oh, it's okay. Go ahead, Larry.
Yeah, I'm curious that thank you for the presentation. I haven't tried acupuncture, but have been considering it. And is it your understanding that there are acupuncturists who are specialize in autoimmune conditions or?
I don't think there are acupuncture specialized in it, but I think that there may be some that have treated more autoimmune conditions than others. I think generally when it comes to acupuncture, they're basically trying to target the tension and the inflammation, whether it's post-injury or whether it's a disease. So I think that that's what they're focusing on. I don't know too much specifics if there is specialized acupuncturists out there. Generally, I have not seen them. It's generally, they're general acupuncturists that have treated autoimmune conditions, but not specific, only autoimmune conditions.
Okay, thank you.
Welcome.
I know someone in our group was recommending acupuncture for a practitioner in Seattle. I think she said was especially good.
Yeah, I think it definitely helps a lot of people. I can't really see it making your disease process worse. So I think giving it a shot, the only thing is it part of your health plan? Are you paying out of pocket for it? I think you can try it for about 4 to 6 sessions, is what I tell my patients. One session's not going to help, but if you try it for 4 and you feel even a little bit of relief, then it's great. If you feel like it didn't help and you're paying a lot out of pocket, then I usually tell them to move on to another technique.
Okay.
Susan?
Yeah.
Yeah, this is Susan. I couldn't find the raise your hand icon either, but I have tried to incorporate some of those things. I wanted to get acupuncture again. I had tried it before and it seemed to have some help, but not a great deal. And I've tried to increase my yoga and walking. So I'm trying many of the things in the list. No one thing is, of course, helping dramatically. So what role can some of the pain medications take, and should they be continually incorporated? Because I am increasing my levels of narcotic pain medication as the years go by, and it will typically take me maybe 1 to 2 years to need to significantly increase my doses. So I don't know whether I'll be able to get off of pain medication like that.
Mm-hmm.
Or should I even try? Just comment a little bit, please, on some of the pain medication working with all of these other options.
Yeah. So what I typically like to tell my patients is, I think that pain medications are used by most of my patients to help them do something, leave the house, or just to exercise or do something more than just sitting around, I guess I should say. And so I honestly tell my patients, I see you're on pain medications. I see you really do need them, but if your pain scale does come down after you take them, then I want you to take a moment to stretch, to do yoga, to do 15 to 20 minutes of something that is actually going to help reduce muscle tension and help you loosen your joints and help you decrease inflammation, because realistically speaking, the narcotics are really just reducing your pain levels. They're really not reducing inflammation in any way. So that's how I like to tell my patients to take them. And again, another thing is that if you're not sleeping at all because you're in severe pain the whole night, that's another thing. I tell my patients, if you're in severe pain and you can't sleep, that in itself is causing increase in inflammation. So I tell them to take something before they sleep once in a while when they're in a lot of pain. So those are kind of how I like to tell my patients to use their pain medications. I do have patients on narcotics. It's difficult to wean down once you've come to a certain level if your disease process is just progressive and worsening. So, it's hard, for someone who has something going on, then it would be difficult to come back down because your body does get used to the higher level of narcotics and your disease process is not really improving per se. Your inflammation is still the same. So you may have to end up every few years increasing your medications, which is normal. I hope that was helpful.
Yes, it was, because I often not quite feel chastised, but it's almost like it's embarrassing to have to ask for more when the whole society seems to be working on the opioid epidemic. It's almost like it's embarrassing to have to ask for more when the whole society seems to be working on the opioid epidemic.
Yeah, but I think that you're seeing a pain specialist, right?
The pain specialist kind of dismissed me after a year because he said we weren't really, that my primary care would be the one to prescribe, and he wasn't able to get rid of it with the other methods. So after a year. So he just said, take it back to the primary care after that and get your pain medication from there. That my primary and get your pain medication from there.